In a land of vast beauty and enduring challenges, a beacon of hope shines bright. The Catholic Health Training Institute in Wau, South Sudan. Here, men and women are transforming their lives and their communities, one heartbeat at a time.
Catholic Health Training Institute is a health training institute for midwives and nurses. It's a course lasting for 3 years for each section, and at the end of it they get a diploma certificate from the National Health Ministry, after which they go to the communities, to different parts of this country, and to be of a great service in the health gather.
We are offering the course of nursing, diploma in nursing and diploma in midwifery, because these are the basic need of our community as per now. Since our country has been in a long war for a long time, most of the services are not there completely, and the demand is so high. Even the one we are producing still is not enough. So the demand for this management of community condition, common condition, children issues, health of children, health and the health of the mother, the mortality of maternal mortality is still high. Even neonatal mortality is still high, meaning that we are really backward. But with this, gradually, there's some improvement to our community, to the country at large as well.
The entry criteria to CHTI is a written exam which will be conducted throughout the country in different dioceses. The exam is centered in CHTI and managed by our own staff.
The requirement said they should finish secondary education, passing in science above 60. Any science subject also should be 60 and above is when we admit them.
Once they pass the exams with the required credentials, then we invite them for an oral interview wherein they will be assessed. Both written and oral interviews will assess the candidate for their knowledge, for their intelligence, also for their aptitude and their attitude towards these courses. So we try our very best to get students from all the states and also from different backgrounds to bring them here and to teach them to live together in unity, and also help them with non-violence living and also for peace building.
We have a program that is called the cultural program, because our students are of different background, from different culture, different tribes. So we bring them together in that program where they have to do everything unique to different culture. We integrate to other students so that they interact together and they see the importance of each person's culture, which makes them unique. Then they can live in harmony in the purpose of trying to build peace among them. Yeah, the thing which makes CHTI unique is, let me say, first of all, the accommodation is there, because in other school they don't accommodate students. They come from their home and they don't get even on time. So we accommodate ours within the campus. They are within, they are monitored, they are modeled not only in the education part, but also behavior and spiritual wise. So that's another unique part which makes it. The second thing is the way our library and our skill lab is equipped. In other institutions, you don't find those things. The skill lab is not equipped in other institutions compared to ours. The third thing is also the tutors we have. We have a quality tutors who are able to deliver the right message to the student. Because they teach even student leadership. Apart from that, we have the sports. See, that's how it makes it very unique compared to other institutions of the government in South Sudan.
At the heart of the Catholic Health Training Institute's mission lies hands-on learning. Clinical placements are an essential part of the training, immersing students in real-world healthcare settings.
Placing students in the clinical area means now you have taught them in the class the theoretical part of the subject. So you have to take them to clinical area to learn the skill, to perfect the skill. We take them there when we have already taught them some skill in the skill lab, what they are supposed to do on the model first. When they have applied the knowledge on the model, then now we integrate to take them to the hospital to see the real patient, how they can interact with the real life, how they can handle life. We collaborate with the hospital administration. Mostly we take our students to these 3 areas: Wow Teaching Hospital, St. Daniel Comboni Catholic Hospital, and the Sika Hadid PHCC, Primary Care Center, so that they learn the necessary skill which is needed for them to qualify. They have to go either 6 weeks or more to clinical area. As they must rotate, each person must rotate all the departments to acquire that skill which is needed for that particular department.
When I found CHTI, it's one of the institutions that caught my heart. Why? Simply because of the quality of the staff they are producing. I met their students when I was a student also. We interact with them. After I graduate, I came as a registered nurse, and they are getting placement in where I am here. It's a very good institution. I really appreciate with how, with the arrangement, with the qualification that they are giving. I like them simply because the students that I see from CHTI, they are very competent. I recently worked with the second-year students, and they were like staffs. I work in emergency room, and sometimes in emergency room, you don't look at coming after the patients, but they work with full responsibility, doing their goals, what they were sent to, very perfect. Then I give them independent. After I observe them for 2 to 3 days, and I saw that they are perfect, they are helping me whatever I do. I also work with them in dressing room. Sometimes I run and I work in dressing room, and they were doing. So I saw in the first time I do the wound, I saw that just simple. These are students second year, they don't know anything. I sure was just teaching them. When I give that student a chance, was doing perfect and to my expectation. So CHTI is a very beautiful institution that need to be promoted, that need to be supported to fulfill the goals of health.
At CHTI, we don't just teach skills, we empower a generation of healthcare workers to bring hope where it is needed most.
When I came, I was not so confident, but I gained confidence here because when the 2 years I have taken here, because this is my final year, I have been interacting with so many people. So I am exposed, and this is how I became the president. I was trusted because of my confidence and the skills that I have learned from the institute. Because this is an institution that is offering holistic services. Leadership skills are trained here. We are trained on how to interact with the patients and how to deal with tough situations. So I have got encouraged from here.
Here in Catholic Health Training Institute, we're having actually like 32 tribes in numbers. By then, I don't know some other tribes, but I came and knew them here in CHTI, and it is a very nice thing to me to meet people from other places, to know their cultures, how they behave. And the other thing is, here we are living as a brothers and sisters. We are one family. We live as we are living just at normal homes. Sometimes on Sunday, let me not say sometime, but every Sunday is for students to cook food. They put the people in duties. 2 people will make the breakfast, and then 2 people will make lunch, and the other 2 people will make supper. So this is our life here in CHTI, and it is very nice because here we are achieving so many things. Some people, even like guys, they don't know how to cook, but they have learned how to cook here in CHTI. Some of us like in this other thing like football, let me say church, any other activities we have learned here in CHTI, and it is a very nice thing. We are not just going to achieve to be a midwife or a nurse, but so many things in general.
When I was in first year, during our first placement, though I know the little things, but we went to the hospital. What I was able to do, the student in 5th year doing medicine couldn't do. So it was something amazing, and it even made me proud of this school. From there I believe myself, even I believe the school, that really what I'm acquiring here is even much greater than degree program. The environment is so conducive. Now, if you go anywhere, you will find places relaxed, and you can even feel fresh to study as much as you want. Even if you are not feeling like to study, just you open the book, things will just, things will just flow. See, it's so impressive.
CHTI has brought a very positive impact in my life. It was a miraculous call for me. Some of us are orphans. Like me talking here, I have a lot of experiences, a lot of challenges, life challenges, lack of support from home and all those kind of things here. But when we come here, we pray and hope that God open ways for us. We always try to at least forget all the hard lives at home and all those. So we managed to come here. Like me, since I came here, I'm 2 years now. I've never gone with holidays because I get support from nobody. I said since the school can accommodate us here during holidays, it is best for me to stay here.
In the years since its inception, CHTI has graduated over 200 professionals, each one now a pillar of strength in their communities. Their impact is visible, measurable, and growing.
I think the success has been really so great because we have graduated so many. I think by this time it should be around 300 nurses, maybe 200 midwives already in the field working, which has contributed to the improving health of our community. This year we have a very good result of the national exam, because when we finish our student the program, we are not the one giving the exam, but the exam comes from the national ministry. So the 4 students, the best student all over the country was our student. That was a sign to us, it was a sign of great success.
CHI is a very good institute that I wish this institute would have been like at least 5 in many different places, that if they can do the same job that I'm seeing here, then this can dramatically change our community in a very fast, a very short time.
Currently, we are offering diploma in midwifery and diploma in nursing. And if it has been upgraded to offering bachelor's degree in nursing or midwifery, that could be of a great support, because even the student graduating from that can help to teach the diploma course as well, because we are not saying that we will stop the diploma program completely, but at least there should be something upgrading into that. So it will be of great support for this country, because mostly we don't have that program within South Sudan. Very few offering that program. When we want to send a graduate for upgrading, they have to go to Kenya, maybe Uganda. So if this one can offer, it will be also of great support.
CHTI, not only diploma is enough, but we also need a degree program to be initiated here, so that we can continue from where we stop. Because if you graduate from here, obtain your degree from CHTI, you will be the strongest person. So we are really urging, if there is a capacity, people should help to bring degree program, and we continue with it.
Through its programs, CHTI is not only saving lives, but empowering a nation. In the heart of South Sudan, hope grows. You can be part of this transformation. Together, we can build a future where no life is left behind.